question ready, and which is easier for us to clarify some issues there. But if you haven't had a chance, but still you're able or you're welcome to ask any questions or concerns to help all of us to try and make better understanding in the session. Thank you. Now let's keep going for the remaining part of information today. Wenbin differential diagnosis and has been emphasized post differential diagnosis, and skin rashes and the teeth and the gum. And skin rashes here were mentioned specific maculas and papulas. And maculas basically is a kind of all looks like the bleeding like red light conditions, red dots around the body. And they can connect it to form huge areas, big patches of bleedings, bleeding like rashes on the bodies. And they don't change colors when pressure is applied. And no skin texture changes, so very smooth basically. They don't feel prickling, and very, very smooth, looks just a part of your skin, just change the color spontaneously. The reason is because the pathogen trapped due to the blood leaving the blood vessel following attack on the nutritive and blood levels by heat from excessive in the stomachs. So they're based on TCM understanding. So overall is the permeability changed for the capillaries, and all the bleeding comes out blood vessel into the tissues. And that's why nothing comes out of the skin. So you still feel flat when you touch it. Have a look at this one. It's a typical maculas happening for people suffering meningococcal disease. So very serious. They come very, very quick all over the bodies. Very scary. Usually they end up into emergency and require to be specific isolations. Papulas, slightly different. These once you put your hands on these kind of rashes, you feel prickle. They're small millet size of red spots, and they comes out of the surface of the skin, so protruded out of the skin and can be seen and be felt. So feel big prickling, look like pimples, not pimples, just like pimples can above the skin. Color will changes when you put the pressures on top of that. This is due to blood leaving the blood vessels following an attack on the nutritive heat by stagnated heat in the lung. So this is different, so much more superficial. So that's why, and surface of channels or systems, the lung will be involved. If the blood has been go through the muscles, and the stomach will be involved. So different levels of the heat and correspond different channels in TCM and different clinical manifestations. Papulas is more in the surface, maculas is more in deep levels. Have a look at this one. Like herpes rashes, like pimples, and they look similar like this one, this typical papulas. They're very prickle, they're red all over the body, could happen for people who have wing heat in the surface in the lung systems after virus attack. They can go away spontaneously if it's not very severe. So diagnosis, color with luster, if outward moving, and usually this tells you it's good progressions. If the broad red is more indicated with the heat and toxicities, and deep red, usually much more deeper, more intense the heat and the yin and the blood level. If it's more dark or black, excessive heat, toxins, and more severe conditions in the critical stage. And more superficial and passing very easy to vent it out through diaphoretic sweat. More deep-rooted, and usually you need to clear the heat, cool the blood, and by relieve the heat toxins trapped in the nutritive level, blood level through different methods of treatment. Lower density of rashes usually is less severe. If the high density, they fuse together, more severe condition. Yes, Lucy.
Hi, Yingmei.
Hello.
I'm just wondering if this can be linked with allergic-related papules and maculae, or
they could be
infectious disease.
Yeah, any kind of influence can affect permeability of blood vessels and causing blood traveling out blood vessel, either in the muscles, in the subcutaneous tissues, or above the skins. They can have
Mhm.
similar result. But in the
So,
wind being fever related, they have
okay.
different meanings. Yes.
So we've always just got to link it back to, is there a fever or not?
Yes.
Okay.
Excellent.
Thank you.
Thank you. And there's another kind of skin rashes called Malaria alba. And this one looks like the watery blisters, small vesicles that looks like crystal-like, like people have some shingles. They can present on the torsos. These small vesicles, they don't feel severe pain. A very soft touch. They have, liquid can comes out, and they don't have serious discomfort. They can happen all over the body, especially on the neck, chest, and abdomen, usually due to damp heat emerged. Still, due to permeability changed in the blood vessels, and result this kind of lymphatic circulation, body fluid, and have different distributions comes in this kind of watery and vesicle comes out of bodies. And lustrous or shining indicate the qi levels of damp heat involved need to be expelled out through the enhanced perspirations or diuretic. And the dull and withering usually is a damp heat, and shrinking internally can cause more severe organ dysfunctioning. So if skin rashes can erupt it out, always positive progressions. If skin rashes cannot be erupted out, they can result much more organ dysfunction, more severe damage internally. So pathogens instead stay in the collateral and present as kind of small vesicles and very well eruptions. They can merge internally through muscles, through organs, and causing organ damage. Have a look at this one. Some people have this one and happen in very hot seasons. They don't have decent, good sweating. Instead, they find, oh my God, I've lost a little bit of water bubbles on my body all over. And this is typical presentation like this. If the body can show very good, decent perspiration, and this kind of skin rashes can diminish very quickly, or just go to the steaming room, they can help have good perspirations. So basically, this correlates with poor lung qi steady functions. So lung qi not able to disperse, to release passing out through natural perspirations. And in other way indicated, body have a lot of damp. So the damp can trap the pathogens within the collaterals. Common signs and symptoms, as we mentioned, in Wenbing, fever is dominated, no matter early stage, middle stage, later stage, no matter Wei level, Qi level, Yin level, blood level, no matter upper jiao, middle jiao, and lower jiao. So fever is dominated. And they could have concurrent chills in early stage or simultaneous chills and fever. If they have alternating fevers and chills, we know the Shaoyang conditions, and or trapped in the gallbladder and triple burner divisions or channels. If the fever has been so severe or vigorous, exuberant, usually it's already reached to Qi level. So generally, in the Qi levels, Wenbing, fever is much more serious. And if the fever mainly present in the late afternoon at night, and they could be correspond to the Yangming channel division or Qi level, and if it's at night, usually in the nutritive levels correlated. Contained fever. So fever is very difficult to be resolved, usually correlated with both heat and the damp pathogens, because damp is the yin in nature, and which does not like to be moving around, and also easy to mingle around with other pathogens. So when the damp heat affect the qi levels, and fever is not easy to be resolved in short term. So there's a questions. So contained fever is more persistent fever. Yeah. Contained fever is difficult to be resolved. The level of fever is not as high as a purely heat pathogen related fever. Yes. Or lingering heat. And for deficiency type of fever or deficiency body symptoms correlate fever during the Wenbing suffering. And usually the later stage of the Wenbing, so people still have some unresolved heat present internally that shows lower grade fever or correlate with liver and kidney yin damage. And or sometimes fevers only represent in late afternoon. During the daytimes, the person still looks normal. At night, and they can experience fever. This level of fever usually is not very, very high, about 37, 38 or something. That's quite a common one. There's another question. Could you quickly explain why owl fever is Yang-Ming afternoon fever level? Because the Yang-Ming division, when you learned Classics 1, Yang-Ming division dominated what time? Between what time? 3 to 9. Wonderful. 3 to 9. So that's why Yang Ming has much more qi to present it as fighting ability. So fever could happen in late afternoon. So sometimes when they see qi level heat, especially when there is Yang Ming, they could be dominated in afternoon fever. Thank you. Nighttime fevers, but cool during the day. So it's same like mentioned, more in the nutritive level, in the in level of heat, and they have nighttime fevers dominated. And when the sun comes out, the fever will break out spontaneously. And have a look at this kind of image. We know a lot of hot from sun ray, a lot of fever, a lot of wiping out from the towers, causing very bad body fluid leakage and qi leakage. So this sweating could also correlate with fever suffering, especially in the qi levels. So if they have no sweating, usually it's in the Wi level or damp is dominated. If they're sweating, usually heat is already in the qi level. But once the heat is nutritive level, sweating become more stickier. And sweating at irregular interval could relate with the heat in the Shaoyang divisions as well. If a profuse sweating, usually in the qi level. If a sweating after shivering, this could be alternating chills and fever in the Shaoyang divisions. So all of these informations you're already familiar from the foundation and diagnosis study, I believe. Just we repeat it again. And the thirst is correlated with the sweating and the fever in the qi level. So because in the qi level, heat is more exuberant and have very strong anti-pathogenic energies when the pathogens involve the qi levels. So because high temperature of a fever can result in body fluid injury, and the thirst is quite a common correlated clinical complaint. And very, very mild thirsty could relate with, very mild desire, wanted to drink, more severe thirsty, and they have very strong desire, wanted to drink liquid to quench the thirst. If there's no desire at all to drinking water when you have a fevers and affecting your bodies, and you're so tired, very red on lips, usually this kind of heat correlate with a damp or heat already go to nutritive level. So in that kind of circumstances, and heat will be much more harder to manage than the heat only purely in the qi level by itself. Convulsions, muscle spasm, and tremor, it can be correlated with high temperatures when they present in the qi level for children, for some adult. And up to this level, usually they end up in the emergency, have specific intravenous drips to control the temperatures, because very severe and long persistent convulsion for children can cause brain damage due to lack of oxygen. So frequent strong convulsion and stiff neck, clenching jaws, and arched backwards. And this is very typical signs, tells you internal wind has been dominated due to injury of the liver yin from excessive heat. If they correlate with mind disturbing such as coma and delirious speech, that's much more severe, and firing has been affected pericardiums. But if it's only presented as a kind of muscle twitches, tics, lipid tremors could happen in the later stage of Wenbing due to injury of the yin, a lack of sufficient nourishment for the muscles. That is usually very easy to be resolved through proper dietary therapy, proper look after about consolidating yin formula, and some gentle treatment resting can be looked after. So that is no harm. But for the convulsions, it's a very severe one, have to be managed instantly. Some acupuncture bloodletting could manage if temperature is so high by managed convulsions. Okay, now any more questions for the first three lots of the PPT files or informations? Now, because we don't have sufficient English version of informations, so following part involves some revision information, additional information, as well as some exercise. So let's have a look. For the additional informations, we don't need to go through that one by one because we all have learning abilities, I believe. And for some simple exercise, if they don't need much of a brain or thinking, we'll leave you for self-study. If you need some, discussions or some revisions, we go discussion together. Here is basic information we discussed today. Human treatment, so 10, all of the 10 involved, but we still need a based on individual, goes with tailored principle of treatment, reflect for the differential diagnosis. And principle of treatment will be aligned with treatment method in Wenbing. If in the surface, using gentle, vented out. If in the qi level, using pungent cooling and also sweet, clear the heat, supply the yin. If the nutrient level, combine the cold, sweet, salty, bitter together, clear the heat and also protect the yin. If in the blood level, besides all the treatment used for the nutritive yin level treatment, add additional herbs to control the bleeding. If it's all the damp heat involved, we need to combine the heat, manage the herbs together with aromatic herbs to regulate the qi and resolve the damp. Based on different ratio of the damp and the heat, different ratio of aromatic herbs, bitter herbs will be weighted slightly differently. Common treatment method and their corresponding formula. We did not go through detailed discussion because very simple, very brief, and you can read it based on your information learned in the Herbal Materia Medica and the formula, and very easy understanding for that based on the information's name. Common special internal pathogen contraindication, post-care in Wenbing, they're going to have additional information from this part, and skin tongue observations we discussed a little bit. Common symptoms differentiations in Wenbing, we discussed the fevers, thirsty, and etc. And case study, we're going to have a little bit discussion today as well. So we learn this part. We don't need to review anymore. And here is the basic history. You already know this. And this 4-level differential diagnosis start from the 叶天师, or specifically constructed by 叶天师. Sanjiao damp heat differential diagnosis from Wu Jue Tong upwards. And this is specific comparisons for the different levels, functional identification system used correspond to the treatment. So we're all able to read it. Also have comparisons between Wenbing and the Shanghai in regard to treatment and differentiations. And this is very simple exercise we can match and by utilize some mentioned formula in the class today. And Shang Juyin and the Jing Hua has been learned for many, many years for many different subjects. Additional 3 has been added from informations in the PPT and first additional one, which I sent it to you. So by review this kind of answers, just to draw the line, you can exercise your differential diagnosis skills. So just have a quick look. The first one, disperse the wind, drain the heat, so release exterior with adequate cooling herbs. Correspond to what formula, and then to find proper diagnosis. Vent the exterior, resolving summer heat. That is, we learned early one formula today. Dissipate the exterior and transform the damp heat, regulate the qi, and disperse exterior and moist the dryness. So it depends what time you're going to have an exit exam. So during the time, if it's during the summer, you do need familiar with some formula constructions. If the patient comes here with any kind of summer heat, exterior attack with internal organ disorder, you can utilize these additional 3 formulas mentioned here. Okay, any volunteer try this kind of exercise? Choosing something, either you choose something you know straight away or go through onion peelings for multiple choice for the exam. Same for this one. And disperse exterior, transform the damp heat, regulate the qi, 破香凝汤. Thank you. Which one can moisture dryness? So it's easy from difficult. Excellent. So if you're familiar with some herbal name, they present in the formula name. Excellent. So 2 of you, this one. So 2 has been out. So only 2 more left. Vent the exterior, resolve the summer heat. So which ingredients we mentioned specific? Excellent. So 1 more. So first one, 桑菊饮. 桑菊, excellent. Now, and you still can use 银翘散 if the sore throat and the swollen throat involved for the clinical presentation. Now, let's retry it for the diagnosis. So which one diagnosis match with what principal treatment? Attack the protect level and the lung by dry heat. Wonderful. Second, diagnosis and the treatment. They should be aligned. So should have shows mirror image. Attack on the protected level, lung by wind heat. Early stage, excellent. Vent the beautiful. Thank you very much. Are they difficult at all? Not difficult, yes. So this is example. So rest of the exercise, I'll leave you for self exercise. You can share them with your mates. So try contact with classmates, have some social interactions through this e-world. Here is a very important part I want to emphasize. A note for each of the sections. Wenbing is a result of exterior wind, heat, pathogen attack, not cold pathogens. So let's try to compare the difference between Wenbing and Sanghan. Therefore, the formula with pungent warming herbs for relief, the Sanghan are not be used, such as Ma Huang Tang and Gui Zhi Tang. They are contraindicated. Second part is stop using aromatic cooling formulas once exterior symptoms has been cleared out to protect defensive qi. So overusing aromatic cooling herbs, construct formula can result in what? Resulting spleen's qi deficiency. If you do not have a well understanding for these specific points, you can have a try drinking mint tea constantly until you feel sick and feel diarrhea and stop it. So that's a result of overindulging aromatic cooling herbs. But don't do that if you already have weak spleen. Only do that when you have too much heat in your stomachs. Very easy, have red and swollen gum and bleeding gum or constipation suffering. And let's have a look next one. Okay. This second part of the exercise will be similar like first part. Very simple. I leave you for self-study. There's a question is, how about stomach heat with weak spleens qi? If you have stomach heat with weak stomach, you still can try if you want it, but you can have much more earlier loose stool and stomach complaint. So I'll leave this exercise for you to do that at home. Very, very simple one. Once you get 1, you eliminate 1, get a 2, eliminate 2. Very easy one. So very important, I want to emphasize his note here. Simple heat clearing methods should not be applied too early, as a cold and cool herbs may injure yang qi and obstruct qi circulation. Especially for people already go through Classics 1 study, you should be able to understand the importance of a human's yang qi, which indicate vitality of your life. Without the yang qi, basic quality of life will diminish very, very quickly. Second point is How early is too early? Once the heat has not affected your qi levels yet, do not using purely heat clearing method. And once the temperature has been very well controlled, and do not overindulge in the heat clearing method anymore. Thank you. The damp heat disease, due to the damp is very easy mingled with heat. Damp is very easy to find their love, no matter cold heat. Based on one being, the level of the damp is a heat. So damp heat always mingled and mixed together. And when the heat clearing herbs must be used together in conjunction with aromatic herbs for transform the damp. So damp heat is not easy to be resolved compared with singular heat pathogen in the bodies. And based on the nature of the damp is yin in nature and very easy to mingle with others. We always need to introduce aromatic herbs together to regulate the qi to transform the damp, as well as bitter cooling herbs to clear the heat. So dealing with both the heat and the damp simultaneously. Number third of the point is for constitutions of yang qi deficiency. So like Charlie just mentioned, how about I already have exist weak spleens qi? When we're using heat clearing method, should always be careful with the dosage you apply, duration applied for the cases. So starts with very gentle, smaller dosage and stop the formula straight away once heat has been well managed to minimize possible damage to protect yang qi. So yang qi is very important for vitality of the life. If we diminish the spleen qi or damage the spleen qi so badly, it takes a long time recovering. From my personal experience, after the bombardment of lots of medications into my systems, took about more than 1 year to start to have a little bit appetite. Before that, every day you experience is feel sick, nausea, have no appetite at all, just want to throw it out. Anything you put it into the mouth, you just want the first reactions to let them out of your system. And same for this one, I leave you for self-study because the answers you can get from based on differential diagnosis informations, based on the information which I provide for you as additional one to draw lines. They don't need lots of brain challenge. The notes here I want to mention. Okay, checking the additional message which I sent it for you, Charlie, regarding this formula. This has come from specific person with that name, and they have details information, the composition in the formula as well. I have information already sent it for you today through my class message in the additional slides there. They are involved. Now, for these notes, herbs used in harmonizing formulas are dry. They cannot be used by itself in heat-dominated cases, especially when have yin injury, because formula used for harmonizing, they focus on Sao Yang divisions and damp heat resolving. So do be careful. You may need using some yin tonified herbs inside if yin damage already presented. Second point is proper differentiation is required for identify correct applications between qi level heat and the clearing and harmonizing method. Thank you, Ray. And that is not fair for people who cannot read in Chinese. So all the information for this formula, which already presented in the informations which I sent it to you today from my class message. Thank you. Okay, same. This is very simple exercise to review our differential diagnosis ability, to emphasize you have to align principal treatment with differential diagnosis. They have to be matched. And then selecting formula from today's range, all the details information for the compositions of ingredients in the today's additional slides, which are sent for you if they are not in the original slides in the blackboard. Thank you. Now, the note here is very important. And identify location of damp heat is very important before you're selecting proper formula, before you construct proper formula. So if the damp in the triple burner, up, middle, and lower, with the damp heat using 三人汤 we discussed today. If the damp heat in the 三焦 using formula from the additional slides. If the damp heat affect your mind specifically, you can choosing a modified 二层汤, which is, I suddenly forgot that name, with a 足乳. And second part is identify the ratios between damp and heat. 温胆汤, sorry, 温胆汤. The ratio between the damp heat will determine progressions of illness. So if the damp heat affect the upper jaw, heat is dominated. If the affect the lung first, if the damp heat cannot be resolved, the damp heat can further affect the PC, pericardium, causing unconsciousness or delirious speech. So it's very important to know the ratio between damp heat that can help us to understanding deteriorations of illness. If the both damp heat are equally in ratio based on clinical symptoms, and you can apply pungent warm, bitter and warming herbs or bitter cold herbs in conjunction forming the formula. If the heat is more dominated, make sure you have to manage the heat, avoiding further flare up, especially avoiding fire element to have very bad connections with about this kind of heat. If the damp is dominated, look after spleen, look after qi regulations in the middle jaw, look after qi dynamics. If heat is dominated, look after body yin substances, and they're very easy causing injuries. Now, if the damp has turned into dryness, we know when people have exist weak spleens qi, very easy have dampness as a kind of pathogens and accumulate internally by eating too much of dry roasted food, and very easy turn the damp cold become damp heat. So if the damp has turned into damp heat, like dry season, damp season in Australia, or patient has a constitutional insufficiency, a care should be taken by apply the dampness resolving ingredients or method together with yin protecting method or herbs in conjunctions. So it's very important to know the ratio between heat and damp, to know if the damp has already turned into dryness. Damp is very easy turned into dryness. There's a question, not sure what you mean damp turned into dryness. Okay. Now, when our bodies have a damp, do you have enough normal body fluid? Because a part of the body fluid become damp pathogens, yes? So you're going to run out of sufficient body fluid, yes? So you're suffering damp, at the same time, you can feel thirsty. Is that right? If the damp is so severe, you can have serious thirsty, like a previous one of the image of the tongue. They have very greasy tongue coating, but have very deep crack in the middle. So that means damp can turn into dryness, not the damp pathogen turn into dryness. Damp clinical manifestations turn into dryness clinical manifestations. Thank you. Second is, damp is very easy resulting qi congestions or restrict the qi circulation. When the qi be restricted, very easy generate heat. Heat will burning body fluid, so become vicious circles. Thank you. And the same exercise, simple one, focus on correlation between principal treatment and differential diagnosis, as well as correlate formula we discussed today. And they are very common used formula we discussed today, and providing additional slides. I'll leave you for self-study here. Note here is very important, help us understand additional information regarding Wenbing and correlate formula and herbs. The first is, both Da Huang and Mang Xiao are common compositions in purgative formulas, big families of Chen Qi Tang family. A care should be taken while apply such strong formula. So once the bodies already have achieved the bowel movement, and stop taking it or reduce the dosage for basic maintenance. Second point is, for fever with no physical obstructions in the intestines, and apply the heat clearing herbs instead of purgatives to protect and internal antipathogenic qi. So this is obvious. If they're only in channel, we're using Bai Hu Tang. When they go to Fu organs and go to using Chen Qi Tang family, which is similar like you learned from the classics one, similar like we learned in the formula sessions as well. So if there's no constipations, using Bai Hu Tang if the fever dominant qi level. If they have constipation together with fever, using Chen Qi Tang formula. Second point is, during the Wenbing suffering, if the heat has injured body fluid and accompanied with difficult bowel movement, purgative herbs should be used together with yin-nourished herbs to moist dryness. The reason is they are not a simple Yang Fu organ obstructions. They are suffering Wenbing, suffering heat-dominated and the syndrome. So besides of open the bowel, you also need, besides using purgative herbs, open the bowel, you also need using yin-nourished herbs to moist the intestine, to supply the yin has been injured by yang pathogens in Wenbing. Number 4 point, besides large intestinal obstruction caused by dryness, if there's other pathogens involved, apply comprehensive approach such as Xuan Bai Chen Qi Tang for dealing with both flame heat in the lung and intestinal obstructions. And last one is, if purgative method has not been applied on time, they are causing further more yin and qi injury or maybe mental disturbing as well. Hence, simple purgative method is not applicable, but purgative and tonified combination could be used together, such as Xinjia Huang Long Tang. So let's have a look if any details formula has been provided for you. There's another exercise, have different correlated of symptoms. There's another note talking about heat pathogen as still, if the heat still in the qi level, the method for clear the heat from yin and blood should not be applied too early because salty herbs, sweet salty herbs, and in combination can maybe leading the heat into deep level. So clear the heat in qi level first, and before you're using salty herbs, because salty combined with bitter have descending in nature. Once the heat in both yin and blood level, they must have both body fluid, and yin injury, so have to using sweet, salty, cooling in conjunctions to clear the heat. Once the heat enters the nutritive blood level, if there's orifice obstructions or wind disturbing internally, you have to add some herbs to wake up, to open the orifice, to ease the wind, and to make sure the brain still have sufficient oxygen supply and do not have too exuberant heat, further damage the body fluid, do not have too unnecessary convulsion and causing much more damage for the systems. Convulsion is a quite common symptom in Wenbing if the fever is so exuberant or dominated, and proper differentiation is required before applied formula. So if the heat in qi level at the same time has convulsion, you can use Bai Hu Tang together with the Gou Teng and the Tian Ma. Now, because the Ling Yang Jiao has been banned, you can use Sui Liu Jiao or just using Tian Ma and the Gou Teng. So how to spell Tian Ma? Tian Ma. Oh, the wrong spelling. Okay, thank you. Tian Ma and Gou Teng together. Thank you very much. Oh, what's happening? All right. Tian Ma and Gou Teng together will be very good combinations using the vegetation or plantation source herbs to dealing with convulsion. If there's intestinal obstructions heat with the wind, so you have constipation together and suffering convulsion, you can use Chen Qi Tang together with Tian Ma Gou Teng. So do not worry about animal products. If children have these kind of high temperatures with convulsion, not all the convulsions due to liver heat, and some of these due to spleen qi deficiency. So differentiate the wind, disturbing wind, and before the proper formulas. So I believe some of these conditions you learned in the pediatrics. And the insects of wugong and quanxi, centipede, and scorpions are very common applied insect source of the herbs to dealing with convulsions, deal with the wind obstructions cause of troubles. And they are very warming and dry. To be careful using that one when patients already have yin deficiencies, and they be using that for a long time. Only using it temporarily if it's really necessary. Usually using cooling one, gouteng, tianma will be much more safer. And lastly, the tonifier herbs can restrain the pathogens or contain pathogens. Pathogens do not use that in very early stage. Usually used in the later stage and when the deficiency become dominated conditions. Can we use wugong in Australia? I think this is not banned. Wugong is a scorpion, centipede. Quanxi is oh my god. Wugong is centipede and quanxi is a scorpions. Are they banned? They are not banned. Yeah, you can find in the backyard. Yeah. You can breed it in your backyard as well. Now, yin deficiency is quite a common clinical presentation for Wenbing suffering. And yin tonified herbs usually can be used in later stage of Wenbing conditions when yin deficiency is dominated. And due to their sticky and cloying natures, they are not supposed to use in the early stage. And usually they're used together with other herbs to deal with the pathogens or resolving unresolved heat, or used together with aromatics regulate the qi. So do be careful when you're using yin tonified herbs in the Wenbing as well. And what's that question? Can get from winner? Oh, okay, it's a herbal supply, sorry. If the damp heat disease turned into dryness, even there's yin injury, but the damp is still primary pathogen. So resolve the damp first, at the same time, maybe added small amount to look after yin. So here tells you how to constructing the proper formula in regard to both the damp and heat pathogens involved. And here is basic emphasize has been presented in the formula. Be careful when we apply pungent warm herbs in Wenbing. Careful using diuretic. Be careful using yin tonified herbs. The same. Be careful using bitter cooled herbs for long terms. Now, here's also revision for the herbal knowledge. I believe all of us are capable to do that by ourselves. Is the herbal materials involved? And the reason this here tells you if they were presented with a flame fluid internally, if they have blood stasis inside, if they have blood stagnation, if they have qi congestion, correlate with Wenbing. What is the common other herbs used and safely in Wenbing conditions for construct special formula? I think my tongue started mixed up. Now, there is additional information talking about post-care of the Wenbing from the resources which I get it here. And they are not examinable, but very important information. You should be able to read it by yourself. One is from dietary to supporting, second from new formula listed in each of these slides. You can read it by yourself, very easy to read it through, very easy understanding. Now, regarding the tongue differential diagnosis, we discussed a lot through the tongue image. So details of informations already presented in the original slides and also have additionally presented here. You can read it, review it, and a lot of overlap with online information as well. And the breaks, you can fill the information based on answer provided in the break here. You can fill the gap to review, to have a self-revision exercise by yourself. Lots of overlap information. And this is a self-revision regarding to skin differential diagnosis with the basic concept or basic understanding natures of skin conditions. So very simple to work it out. So what we need to do today. All right. There's a lot of case study. Lots of cases we need dealing with. One is case study for your basic exercise. One is case study or case problem resolving in the clinics and or in a final exit exam. So these are typical examples to review how to understanding the fever or fever-related chills or the strength of fever and the duration of fever and specific nature of the fever and correlated with basic answers. They are very important for us to go through differential diagnosis. We just using these slides have been exercise. Leave the rest for you for self-study. I have a try to draw the lines when you're ready to link the basic symptoms of fever, nature of fever with the possible reasons based on from the TCM understanding. Thank you. Excellent. Wonderful. Content fever. Don't forget what means content fever. Content fever is and concurrent fever. What means concurrent chill? Early stage. Good. That's good. Concurrent fever. Damp heat. Excellent. All right. Concurrent fever also correlated with what? Something in the Shaoyang. But because there's no answers involved, you only can go through this way. All right, it's very simple, very quick. So very subtle question you can ask from queries. You can find the guiding go to complete different TCM pathologies. Number 2, alternating fevers and chills. Triple burner, yes. Chi and triple, all the upper, middle, and lower burner can happen. They could have alternating fever and chills, and they may do not have typical Shaoyang fever like we learned in Classics 1, but this can tell sometimes very, very hot and suddenly after a few minutes it becomes so cold away, and this kind of heat can cover all these areas. Yeah. Number 1, concurrent chill in the surface. Early stage 1B, they could involve the Shaoyang as well, but because it's early stage, using E is very easy. On number A, heat from constraint in the gallbladder. These are Shaoyang constraint. These can have both concurrent chills and alternative fever and chills. So if you have as well as content fever, so this, okay. Number this and this and this, they all could be involved in the heat constraint in the gallbladder, or we call that damp heat constraint in the gallbladder. So 2AB, 2AB. Concurrent chills. So you can have alternative chills and fever, so you can say concurrent chills, either related with early stage 1B or could related with the Shaoyang gallbladder. And alternating chills fever, definitely with gallbladder, and content fever could relate to damp heat disease in the chi level, and they could also relate with damp heat related with gallbladder. Damp heat related to gallbladder Shaoyang have lots of alternating chills fever. They could present as content fever or concurrent chills. If they're alternating, that'd be much more typical in Shaoyang. So in the question, sometimes we only ask the fever, we did not ask the chill, or sometimes only ask the chill, did not ask fever, or sometimes ask both, but did not ask when they're coming. So if you ask clearly, they may tell you, oh, yesterday I feel so hot, but today I feel so cold in the morning. And they don't have very clearly periodic chills fever, that this periodic have different interval. They still call the Shaoyang level has been trapped with both damp and heat. Thank you. Very good questions. Oh, why they disappeared? Why they disappeared? Why they disappeared? Sorry. I'm not good with computer. Now, So after this simple exercise, have a look what's the other slides we should go through, or leave all of that for you for self-study. I'm not good. 1, 2, 3, 4, 5, 6, 7, 8. We did this. We did this part. Yes, we did this one. And the lower grade fever elevated at night, nighttime fever, but cooling in the morning. This is a very simple one, obviously. And both of that could be involved. And so you can answer this one by yourself. This from basic diagnosis, differentiations, and also we should know this very clearly. Yes, is that easy to understanding for these answers? Absent of sweating, usually what? In the superficial, yes. Sweating at irregular interval, 瘙痒, profuse sweating, qi level, sweating after shivering, could be 瘙痒 as well. And sweating on the irregular intervals, if sweating very sticky, there could be in the nutritive level as well. So it depends the quality of the sweating as well. So checking the slides we discussed today, very easy to find the answers here. Is it possible no sweating at chi? It's impossible. If at the chi level there's no sweating, and there's not in the chi level. In chi level, you have to have big four. Remember big four we learned in the second year. You have to have a sweating because at that stage, heat is exuberant, very strong. It pushes the body fluid out of systems, or they alter permeability of blood vessel. A lot of sweating very easy comes out. That's a natural protection of the cell body. Otherwise, they'll go to nutritive level straight away. If there's no sweating in the chi level, they go to both chi and nutritive level and result very sticky sweating. That's very severe and can cause convulsion very badly. Leave this one free as well. Now here comes very simple case study. Have a look at this one. This is a very important case. You have to very well understand this case regarding overall conditions as well as this formula. This is a very, very beautiful formula. So if I mention something very important, they are very important, both practically and also in the practice. So they're all very common use formula. 文胆汤, 好情清胆汤, 大柴胡汤. Have a look, any volunteers to go for the diagnosis and principle of treatment? Just put one sentence in the slides. So alternating fever, chills. It's a typical 瘙痒, but based on Classics 1, after 2 weeks, especially after 7 days, if problem cannot be resolved, still have both fever and chill presenting. So pathogens, which level? In where? Not V level, definitely. Not Qi level, but have to be in the gallbladder or 瘙痒 level. That's why I have alternating fever and the chills. Bitter taste, hypochondriac pain, and further evidence problems in the gallbladder or liver channel, you call that. Have too much of heat involved or obstruction in the channel. Redness, thirsty, yellow urinations tells you heat and congestion, 瘙痒, epigastric tensions, nausea, problem go to which part of bodies? Go to middle gel with weak spleens, loose stool. Rebellion stomach chi goes up and chi obstruction locally. Red tongue, further evidence together with yellow, so tells the problem not in the V level, not in typical. You can say in the Qi level from 4-level differential diagnosis, but it's not single heat, it's a damp heat. That's why yellow greasy. Wiry rapid pulses, further evidence tells the liver channel involved with heat. So overall, is it a purely heat or damp heat? Is damp heat in where? So unresolved damp heat in the good is definitely no pathogens damp heat. It's unresolved damp heat in where? In the middle gel itself or middle gel and Saoyang? It's in Saoyang and the middle gel. Good. With underlines weak explains qi. So there's answers tells heat, drain the Saoyang, heat from the constraint in the gallbladder with a flame and a damp. So what formula is proper? 大柴胡汤 is for 大柴胡汤 for 少阳阳明 problem simultaneously. You have to have constipation. So is there constipation involved or loose stool? There's loose stool. Yes, it's a loose stool constipation. There's a loose stool. So 好清清淡汤 is a good one. Or you can use the modified 文胆汤. It's up to you. It depends how much you understand this kind of formula. When checking details composition, 好清清淡汤 is great. And also 好清清淡汤 excellent for 温病 problem solving, especially damp heat trapped in middle gel affected both stomach, spleen, and gallbladder. So here, I have to recommend this formula for you to do further research. Very, very good formula, especially the topic you're choosing and damp heat warmth related. You need to consider this formula. Very, very beneficial. How is qing? How qing is huang qing. How qing? Oh, this is a wrong spelling maybe. It's a wrong spelling. How qing? How qing? How qing? Huang qing. Thank you. And details composition, additional slides, which sent it for everybody through my class message today. Have a look. Second. Oh yes, here have a. Oh God, I forgot it already. So here's the details information. So how qing. Oh, it's correct. How qing. How qing. How qing. How qing should be huang qing. Okay, it's a wrong spelling. How qing qing. This one have a G. How qing qing dan tang. This one does not have a G. How qing qing dan tang. Thank you guys. So we can find errors now. Qing hao qing qing dan tang. Okay, all right. Let's have a look. Second case. Again, selection formula 好清清淡汤、三仁汤、小柴胡汤. They're all very popular, very valuable formula. Can be used in the Shanghai, not in Shanghai, the Wenbing and conditions. Have a look at this case. Patient has been feeling unwell for a week with fever that's getting worse in the afternoon. So have fever in the afternoon. So feel something's unwell for a week. It's already past the Taiyang division conditions if you learned classics 1. If you have not learned, so this basic already passed, it should be go through the V level conditions if the problem has not been resolved and go to deeper, either Saoyang or Qi level or other levels. So main concern is fever in the afternoon and remains after sweating, fevers afternoon, and also fever still present after sweating. Slight aversion to cold. Chest and epigastric region distension. So there's a dampness involved, resulting chest and epigastric distension. Scanty urines, that's a result of some level of heat involved pathogens. Wide greasy tongue coating, also damp coat involved in the middle gel. Soggy moderate pulses. So damp is quite severe. That's why pulses soggy and restrict qi flowing. So they have all the damp all over the bodies. And that's why this kind of fever only happens later in the afternoon in the Yangming regions there. And also sweatings does not help resolving the fever. Still have slightly aversion to cold. Some, we call that, still have regions in the Taiyang region still have a kind of trapped cold. Person has not been resolved. Usually it's a result of damp trapping surface. In another way, just say Shaoyang division has been trapped by damp heat. Still can help understanding these conditions. And the damp is all in all up, middle, and lower gel. So in upper gel represents slightly chills feelings and fever, and sluggish sensation in the chest, epigastric regions, middle gel, and scan urination result heat dominant lower part and wide greasy tongue coating. Damp is really dominant. Middle gel is more damp cooled. For people very easy have this kind of damp covered all over, they have to have precursor weak spleens qi. If you have a strong spleens qi, you're never suffering such an overwhelming damp affect all the triple burner. So here I have a question I want to clarify. In one being series, whenever we have dampness presented, are we always using the triple burner over the 4 level for different diagnosis? So in what circumstance are we using 4 level? Heat. In what circumstances using sand gel? Heat and damp. Yes. Thank you for the question. So when you have both damp heat pathogen presented, we're using sand gel differential diagnosis series, because if you're only using 4 level differential diagnosis and damp is not very easy to be looked after regarding to the series and applied or treatment applied in 4 level differential diagnosis treatment. And in the 4 level differential diagnosis, they do not have very well information presenting the damp heat simultaneously affected the bodies in both qi level, nutritive level, or weak levels. Thank you. So 三人汤 can be used for this case, or you can use a modified 小柴胡汤 or modified 蒿芹清胆汤. Depends how good your understanding for each of these formula. So I leave these 3 formula for you as option. You can modify from all of that. Thank you very much. What is the diagnosis? The unresolved damp heat or damp has affected all the triple burner with qi obstructions. That's why I have congestion, feelings in the chest and epigastric region. So you're using a formula to aromatic to resolve the damp upper middle level and combine with ingredients diuretic in the middle level and add together with aromatic regulate the qi in the middle burner or for the whole body to restore the qi dynamics. So for this example, they utilized or they selected 三人汤 using 3 kernels, resolve up, middle, and lower gel damp flame using and middle 2 formulas, resolve the damp, restore the qi dynamics using last bit to resolve the dampness related with urinations. The last formula for last case discussion for today is a case suffering epigastrics. Substitute for the 华石, it's good just using 通草. 通草 is good one. 通草 is gentler one. Yeah. 通草. So for case 3, this patient has been suffering epigastric and abdominal distension for 2 weeks. So based on the first sentence, you know it's not purely heat. Something either with a damp obstructions or damp obstruction and with qi stagnations. There's also nausea, vomiting. So further evidence with this digestion complaint tells you they have qi dynamic disorder due to dampness. A sense of incomplete evacuation for the bowels, so qi obstructions, yellow, sour smells, stool. So there's a damp, there's a cold, sour smells. And the thick yellow tongue coating, damp heat, turbid tongue coating. So it's a typical damp heat trapped which part of the body? Upper jaw, middle jaw, lower jaw. Upper burner, middle burner, or lower burner. Middle burner. Middle burner is more dominated in the digestive tracts. So nausea, vomiting, loose stool, or incomplete motion. Yellow greasy tongue coating. And if you're not sure for the practical, go to the clinical practice. Once you resolve the middle burner damp for this one, lower burner will be much more easier to be restored properly, because here have no difficult urinations. You can leave the lower burners free, focus on middle burner to restore the digestive function first, resolve the damp in the middle gel. So what formula from the list is good to resolve the damp heat in the middle gel with incomplete balance? Sluggish. So first one can help Even people do not have constipation. When you find you have incomplete bowel movement, that means you don't have proper vacuum of bowel. Still call that sluggish, damp heat obstruction in the colon. You can using this specific formula to resolve the damp heat in the colon. 子时导致脘, so they utilize a few different herbal pairs, combined the purgative herbs and the food resolving accumulation resolving ingredients and the damp heat resolving herbal pairs and spleen strengthen diuretic ingredients all together. So if you don't have this formula in your head handy, you can select different herbal groups and formula still can use resolving these conditions. Remaining cases, I leave you for self-study. Very simple to go through because all the answers are already provided. So what I need to do today, we keep going to review some tongue, which the image I sent to you in the past. We need to focus on today's social tongue. So have a look. This is the tongue, very commonly correlated with Wenbing in the clinic. And can we all easily recognize the tongue coating they all presented for these three images? They all have tongue coating? So that means you can not see the naked tongue body. We can always find the tongue coating. So which one have the thickest tongue coating compared with these three? Okay, number one have the thickest in the lower jaw. Number two have a thick all over. Yes, is that right? So number one have the thickest at the bottom, at the lower part. The front part, middle part, maybe not severe. With the tongue compressing sticks, you can see very, very dark, greasy tongue coating for both first and second one presented in the lower portion of the tongue bodies. But for the whole tongue body covered, even the thick one is second one. The whole tongue body covered very, very thick, greasy tongue coating with the lower jaw specifically gray and the dark one. Either people has been smoker in the past or that tells you severe heat has damaged the yin, resulting from conventional understanding your normal flora in your gut has been very bad damage, resulting abnormal fungus breeding in the systems. Medication can affect our spleen very badly and resulting poor TT functioning eventually through the healing, and this kind of dark tongue color can be presented. Once they don't have very red tongue body, and usually they are not very severe, they do not have a structure damage with regard to tongue coating. Tongue coating represent which level of this abnormality of the bodies. Is a chi level or blood level? Chi level. So once the chi level has been disturbed, there's no structure changes. But once the blood level, so both nutritive and blood level involved, so structure changes, they're going to have damage for the organs. So here just mentioned dampness in the lower jaw, very severe. But can you see ink damage in any images from these three tongue? Number third have noticeable ink damage. How about number two? Is any ink damage there as well? Yes, good. You can see multiple tiny cracks presented in the second one. More severe deep cracks presented for the number third one, like one we have already seen that today. So number third one is more severe ink deficiency happened in the past, not currently. Why not currently? Why it is past? It is deep, and most important, the color of the tongue. The color of the tongue is fresh red or pink red. Pink red. So because the tongue color tells you the evidence of the deep cracks is happened from previous illness as kind of progressive damage happened, but not from current high temperatures or one being suffering. So this is very important. Compare the tongue coating presentation, tongue color, indicate the level of Wei, Qi, Yin, Xue, white and yellow tongue coating, and also trying to differentiate tongue color based on is a current or previous suffering. So because the tongue color is a pink red, tells you this crack has been presented there as evidence of ink deficiency from something happened in the past. Now, for the second tongue and first tongue, so all these three tongues, none of these have very typical current high temperature suffering because all the tongue color are not bright red, not purple red, not crimson red. They're all towards a dull red. Thank you. But they all have some level of damp. First one has not shown serious ink deficiency yet from this murky image. So let's have a look. Any example of the tongue shows typical and current heat or not? Okay, we go backwards. All right, how about the second tongue here? Now the little dent, scar tissues due to they have a tumor cancer growing there. That's why they have part of lack of tissues in the tongue on the left right back. So don't worry about this one. This has already goes through operation, cleaned it up. But the tongue shows you something still have very current impact regarding the tongue color. Yes, even a little bit purple, dull, red, crimson together, but much more brighter compared with first one. Yes, first one tells you something chronic, things happening, and something happened in the past, more paler one. But this one tells you still something has not been resolved, some heat, still quite severe, trapped in the systems. So still have a heat trapped all over the bodies because the whole body of the tongue quite dull and red. Do you agree? But there's very clearly bright yellow dryness presented from middle towards the back. So either from medications or people was a smoker in the past. So very dehydrated and yellow greasy tongue coating. And there's not enough tongue coating from frontal part and very red here. So this tongue presentation could represent it in the Wenbing in the later stage. So still have residue of a damp trapped internally and with this kind of dehydrated damp heat and lower gel and go to some indeficiency stage start come through or problem in the part of both qi and nutritive level or damp in the middle and the lower gel. For the first tongue, in which stage of Wenbing the first tongue could possibly present it? Is any tongue coating here at all? Yes or no? Do you call this geographic tongue coating or no tongue coating? So looks like there's no tongue coating. Also looks like geographic color presented in the bodies. So if you can see little bubble-like things, can you see a little bit bubble-like structure taste buds here? Yeah, there's no tongue coatings presented on this tongue body. I hope this is not ordinary people, it's just the models. But they present on the models, I don't know how to explain to you. They may relate with serious blood deficiency or some autoimmune disease because patches of these are, okay, I can't draw that one, I'll use different color. And maybe related with something very serious. You see the circle on the tongue here? Can you see the circle here? Can everybody see the circle here? Oh, I can't show that one. Yes, oh good, you can see that one. And with these discolorations presented on the tongue body, and maybe some very serious issues already alter the whole digestive systems. You can see all this color loss here, very serious. All these very funny geographic tongue coating, geographic patches of color presented here. They have very, very bad autoimmune disease involved. But with teeth marks, we know spleen's qi is very bad, spleen's blood very depleted, and may have very, very poor digestion. most of autoimmune disease, people suffering, they do not have a healthy digestion. So for this tongue, shows very poor digestion because tongue coating represent the stomach's qi. Without the stomach's qi, you don't have a normal healthy appetite. And without normal healthy appetite digestions, you are not able to absorb enough nutrients. Ended up, you can much more vicious circle cause of autoimmune disease related correlated suffering. Now, number third image. Can you all see these kind of funny and unsmooth bulging sublingual veins? Even has not become severe zigzag yet, but you can see this basically not smooth, looks like a little bit of worm. Yes, can you see that? Presenting sublingual vein here. Good. People present with this kind of tongue coating. Thank you. Usually, if it's a woman, very easy suffering period pain. If the both gender, usually tells you they have very poor blood stagnations, already have exist blood stagnations. So based on the limited range of the image, we can see lower jaw, middle jaw, even upper jaw have represented blood stagnation. So they have what? Much easier to client have a stroke in the brain. It's not I say, it's research already found have strong correlations about this because they don't have very good and the muscle tones or good structure of the veins or arteries. They can show in other part of cardiovascular systems, and they have very sluggish blood circulation internally. Or in another way, they don't have strong heart muscle. They don't have a healthy cardiovascular systems. In TCM, they don't have a strong yang qi. They very easy have blood stagnations. We know death is progressive coagulations. And so this in TCM is yang deficiency with blood stagnations. Now that's all for today, and thank you very much. If you have no questions,